7, 6, 5, 4.
Whoa! As you know, this happens in a lot of bedrooms around the world. People get excited when the countdown begins, but they miss out on so much, with so much disappointment and unfulfillment, just like this champagne bottle that just popped. Now, for a lot of these so-called one-minute men, the expectations from a lot of women far exceeds the times. Now, I sampled some women, and this is what they expect our men or these men to last.
At least where 30 to 45 minutes later.
When I love you, at least it should be an hour.
An hour?
Yeah.
Okay, but if you don't love the person?
At least 30 minutes, it's okay.
5 minutes is too short. 40 minutes is okay.
Maybe 15 minutes, you're okay, ma'am.
5 minutes there, it's a no. 30 minutes is fine.
As a result, these unrealistic expectations lead most young men to abuse substances.
Some drink, if it makes it with condiments, if you used to it go well. So at that time, I used to do them well. Then feel it, but he helped me. If I say he helps me a lot.
Me, I not smoke cigarette.
So what do you smoke?
Only ganja.
Only ganja. So the ganja helps you out?
Yeah, if I smoke ganja, Charlie, but guys, forget. If I smoke ganja, I feel okay. I will feel well.
But how long should sexual intercourse last? Well, according to healthymail.org, most men ejaculate between 5 and 10 minutes. Research has shown that on average, the ejaculate time is 5.5 minutes after penetration. Could this be classified as premature ejaculation? Here is Dr. Bernard Tobo, who is a lead consultant urologist at Shape Healthcare.
Generally, 5 to 7 minutes is said to be standard. By definition, by the way, premature ejaculation is when a gentleman or a man is not able to voluntarily delay ejaculation, and it causes him distress, causes the partner also distress, and then the relationship is also affected.
He says a lot of men encounter this problem.
Most commonly between the ages of 18 and 30 will experience one problem like that or the other. And for that subgroup of patients, you realize that most of them are not married.
But what causes premature ejaculation?
So you have people who have lifelong premature ejaculation. So right from the time that they started having sex, they started ejaculating, almost 100% anytime they penetrate, or even before they penetrate. And then you have some people who have acquired. So previously, they were having sex okay, they were lasting quite long, their partners were happy. Then along the line, because of certain conditions, they start going below the 1 to 3 minutes, mark. And there are some people who have the variable. Variable means that most of the time, sex is good. Everybody is happy. But once in a while, you ejaculate very early. Then the last type is a subjective type. Subjective type in the sense that for these class of men, they tend to have normal durations. But when they compare the current situation to what used to be, they've realized that the time has reduced. And sometimes for these subjective types, you may find that their partners have very heightened, or great expectations. And that can also cause a lot of distress. With this lifelong one, there's been association with certain genetic traits. So probably the grandfather had it, the father had it, and then you, the son, you have inherited it.
And how can it be treated?
There are simple techniques. There's one we call the start-stop technique. Basically, when the couple are having sex and the male feels like ejaculating, he withdraws and then concentrate on other aspects of love making. So more of foreplay. Akin to that, we have one we call the squeeze technique, where once again you have the sensation to ejaculate, and then your partner squeezes the head of the penis. That's the very most sensitive part of the male anatomy, but does it gently, squeezes it, and the sensation goes away. Then you go back to the act again, and you repeat it severally, 3-4 times, or as the case may be, severally, till you feel like both of you have had satisfaction. When these don't work, There's a place for a specialized exercise called Kegel's exercise. There are medications that can be used, and there are various types. There are types like gels which can be applied on the genitals or sprays. And the aim is to numb the genitals so that the partners can last longer. Some people use condoms because, once again, just to reduce the sensitivity. And then you have some other medications like, tramadol, which people abuse, unfortunately.
Premature ejaculation is a common and often distressing problem for men, causing distress for men and their partners. While there are treatments available from psychological methods to medical intervention, many men are unaware of what premature ejaculation is and how it can be treated. As such, there is a great need for further research and awareness into this issue to help those who suffer from premature ejaculation and allow them to have better quality of life and relationships. Emmanuel Samani, TV3 News, Accra.